Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Hello, everybody. Welcome once again to our podcast. We're so happy to be with you, aren't we now, Mark?
We are. We are always. So I spoke to a couple of dentists last week who listened to our podcast.
Oh, yeah? There were that many, huh? Two?
Well, yeah. And it made me feel good because during the conversation, you know how we get. I guess we feel like we have to explain everything, right?
Yeah.
And while we're explaining things, they hurry you up and they say, "Oh yeah, I know. I listened to your podcast."
Oh yeah.
Oh, that's cool. I know. Or yeah. I read your book. No, I got this, man. Don't worry. You don't have to explain it to me.
Yeah.
Right. So it really, really helped. Like they get it.
Yeah.
They understand. Anyway, it was. I'm glad we do these podcasts.
Yeah.
Little tiny bite-sized chunks of information, which you and I are well past millennials. And, I think the millennials started this. They wanted everything in 5-second increments or less, right?
Yeah. Pretty soon we'll just be down to emojis and grunting.
Right. Exactly. But we're older. So, the 20 minutes, 30 minutes, and we can get into the meat of the topic. And so anyway, it's good for the treadmill. If you can get on a treadmill, put your earbuds in, listen to us for a half hour, you'll get a good workout and you'll get some good information.
Yep. And get healthy too. Okay. Today, we're going to talk about plateau points in dental practices.
Yeah. Just got off the phone a little while ago with one of my favorite humans, just a good all around guy from Middle America out in the cornfield somewhere, and he was a client of ours for about 3 or 4 or 5 years, and then stopped, which is fine, and then re-engaged us about 1.5 or 2 years ago. And it was the plateau points that caused the initial engagement. It was the plateau point that caused the disengagement. It was a plateau point that caused the re-engagement, and now he's at another plateau point. So I thought, how he came up with this. It was a great idea. It was perfectly topical for today's topic, which is plateau points. The cool thing about dentistry is that the business of dentistry is that most of the normal plateau points are very recognizable. You can almost see them before you get there. And if you can see them before you get there or as you get there and you can prepare for them, you can blow through them to greater growth. And over the lifetime of a dental practice or over a career, it could, it could be worth at least hundreds of thousands, maybe millions of dollars. So let me go through maybe a career timeline of John or Jane Q, average dentist, as they buy or start their own practice. Typically, they're the only one providing any of the work. In other words, cleanings or restorative or any kind of care, patient care. It's usually just them. So normally the first plateau point you'll reach is that, when should I hire a hygienist? And the answer is varied depending on the scope of the dentistry that the owner is able and willing to provide. But let's say it's average, right? Maybe they farm out some third molars to an endodontist and maybe they don't do straight wire ortho and they pretty much do everything else in-house. as soon as you can fill up predictably a day and a half to 2 days of hygiene, it's basically time to get a hygienist. Because even if you're just sitting there, you can still be productive promoting the practice. You can still be productive helping to manage the practice. You can still be going through treatment plans. You can still be following up with treatment. You could be, as the dentist, you can be doing so many other more productive things than your hygienist will, and it'll free up your schedule. And a couple of podcasts ago, we talked about stagnating a practice because you're too full. So that's the inflection point. You don't ever want to get your solo practice where you're the only provider to the point where, you're booked out a week or a week and a half and you're doing your own hygiene. That you already have enough room for a hygienist for a day or two. And so as soon as you do, that's your first plateau point. Get yourself a hygienist. The doctors who got them earlier are far better off than the ones who waited until they plateaued financially and then decided to take the jump. So that's your first plateau. Your second plateau is going to happen somewhere around $850,000 a year in gross production.
Yeah, you're talking about gross revenue there, right? Yeah.
Yeah, gross revenue, right, not net. That is a pretty common plateau point for a solo GP. I think almost every solo GP's probably hit that plateau. Many of them are fine staying there.
Yeah.
The problem is that if you do stay there, I can virtually guarantee you your costs are going to go up.
Yeah, don't they always?
Yeah, yeah.
Do expenses ever go down?
Yeah, you can run a business on, I hope for the first time in history my costs go down. You can try to do that, okay?
Wouldn't recommend it.
We wouldn't recommend it, right. So at about $850, now you can stay at $850 for 3 or 4 years and then say to yourself, I can't get off this wall. I can't get past this fence. I can't get beyond this barricade. Like, what's going on? And then you run around and you look at your staff, you look at yourself, you take leadership courses. Maybe you go out and look for new services to offer, implant, sleep apnea, sedation, what have you. Okay, you think it's you internalize it, it's all your fault, right? And then you come back from all these courses, and next year you do $850,000.
Yeah. And then you ship yourself off to the nearest psychiatrist.
That's right. That's right. Well, it wasn't you to begin with.
No,
it really wasn't. It was. There's a lot of things involved here, so let's take them one at a time.
It could be actually one of 8 things, I think, is what we narrowed it down to once upon a time.
Right. It's actually, it could be a combination of any one of, Howie's right, like 7 or 8 things, right? So we can go down this list and we can say, all right, so if you're getting your new patients primarily through referral and insurance plan participation, which, by the way, we visited an office in Philadelphia. This is the exact same story with him. And if you've been doing that and not spending any money to promote your practice outside of referral and insurance participation, and you reach capacity, in other words, you're booked out 8, 10 work days, your new patient numbers have leveled off, your patient base has aged. That's actually one of the 8. You have an aging patient base. In other words, everybody's fine. All you're doing is cleaning porcelain. Okay, there's no more dentistry to find, right? There's no new blood coming in, or at least no new good blood coming in. If you combine all those things and then you assume that insurance reimbursement is going to go down, in other words, there's downward pressure on them paying you, and there's 0 upward pressure on them paying you, then sooner or later, you're going to come to the point you're like, yeah, I'm working just as hard as I used to for less money. And it's true, right?
Yeah.
Okay. So that inflection point, that story I just told, that might be, it's a very common plateau point. I mean, that's actually probably the most common plateau point. That might be the time when, as you're approaching that, where you say to yourself, you know what, I'm going to start relying less on insurance plans for my new patients because their reimbursement is on a downward spiral. And I'm going to maybe start to transition my way into promoting my own practice and gaining the revenue bump there. Maybe I don't want an associate at this point in my career. Maybe I don't want a partner. Maybe I just want to be my own boss, but I want to make more money for the exact same amount of time that I'm spending at the office instead of losing money every year or having to work harder for the same money. Because the only people there is your staff, because they have, they have 3% increases because the Earth made a complete revolution around the sun every year, and they get more money regardless. And if they don't, they're going to whine at you because they haven't. So your costs are going up, your reimbursement's going down. So that's a pretty good indication, especially if you're busy, that you're about ready to hit a plateau point.
Yeah. Actually, we've hit a plateau point ourselves. We're going to be going away for a commercial break. Don't go away. We'll be right back.
Let's play a snappy ad about us.
Hello, everybody. This is Howie Horrocks, and along with me is Mark Dilatush, the president of New Patients Incorporated. How you doing, Mark?
Hey, Howie. How are you? This is the part of the podcast where we get to brag about our company.
Yay.
So sometimes it gets lost in all these podcasts what New Patients Incorporated actually does. We have, I don't know how many podcasts, 75, 80, one a week for well over a year. And all of you listen to these a half hour at a time, and you might lose sight of what we do. So here's the short answer. We do everything we're talking about in these podcasts on behalf of our clients. Okay. The podcasts are there for our clients, of course, just so they understand what the heck we're doing, but also for the doctors who are do-it-yourselfers. If you're not a do-it-yourselfer and you want someone to do this for you, newpatientsinc.com. There's an icon in the dead center at the top of our homepage where you can get a complimentary marketing plan. A series of questions will need to be completed. And once you complete that, we will analyze your market area, develop a marketing plan, and get on the phone with you, discuss all the sections of the marketing plan, just to make sure you understand a couple of things: what you're up against, what your expectations should be, and what Mark and Howie would do if we owned your dental practice.
All right, we're back now. Okay. Yes, here we are at the plateau.
Yeah, so we went through the when should I get my hygienist plateau. Then we went through the hey, when should I start to maybe think about this marketing thing after I use insurance to help build my practice up to a point where I'm busy for 8 days? If I'm booked out 8 days a week, I know I'm busy enough to do that. So, okay, that's another inflection point. There's another one here that we again, this was today, and I think it was Friday, we had another conversation with another dentist who was going through exactly the same thing. And that is, these two things happen almost simultaneously. It's when you're a solo GP and you have two full, let's say a 35-hour-a-week GP, and you've got around 60, 65 hours of hygiene. And you have the one person at your front desk, and maybe you have another person that comes in and helps that person out. That's another inflection point, and it's often overlooked. And that's there's the practice. That's your $850,000 practice I'm describing right there, okay? And one of the things that could fix that problem is you're understaffed. And we ran into two of these just last week, where we have a doctor that has 22, 25 patients coming through that front door every day for 3 days out of the 4 days of the week. And poor Mary up at the front desk, kind of looks like those Asian girls with the sticks and the plates in Cirque du Soleil, right? She's sitting up there trying to put her fingers in all the holes in the water, and they're leaking, and she's trying to do her job. She's trying to do probably a really, really good employee, trying to do the very best she can. But, I mean, she can't. she can't possibly handle that many patients that you're throwing at her. And that's pretty common mistake as practices reach these plateau points, is they don't really recognize when they're overwhelming their business staff. And if you overwhelm your business staff, you'll stagnate your practice every time. 100.
Not to mention, complaints about poor customer service and that sort of thing will start going on. Then you're really in trouble.
Right. 31 years in dentistry, and that happens every single time. Every time. They can't do it. And you already know what they're going to put off. They're going to put off the stuff that they don't like to do. And normally that's collections and following up to get more appointments and put more production in your book. And what are the two things you want them to do? Collect money and put more appointments in your book. Yeah. Okay. So, so that's another really critical piece of the solution to blow through a plateau point. So even if you do transition out of some insurances, maybe if you do ramp up your marketing, if you do all those things, what I'm saying is, don't overlook the team aspect to this, because all the marketing in the world, isn't going to get your front desk person to be able to process more than 19 humans through your office every day and do everything. It's just not going to happen. And even at 19, that person has to be the best. Yeah. So if they're 80% the best, then she's only going to be able to handle 16. Okay. So you're literally overwhelming that person, and you need to plan for it if you're going to get through these transitions. Normally when this happens, what you do at the front is, and you don't have to take my word for it, but I'm just giving you what I've seen work. I don't know how many hundreds of times in my career. When there's one person at the front, that person's kind of the do-all person, because they have to be, because there's nobody else to do it, right? And when there's two people in the business office, then typically what you'll do is you'll delegate duties based on two lines: financial and scheduling. So basically you'll have a scheduling coordinator and a financial coordinator if you have two people in your business office, and one person's focused all day on getting and keeping your schedule booked, right? And the other person is there all day making sure that people have treatment plan consults, people are being followed up on insurance plans, or insurance claims are being paid on time, and she follows up with those that don't. And not too many people have AR issues in dentistry anymore, but if you do have any outstanding balances, following up on those, going through financial options with patients when they come out of treatment consults, so on and so forth. That's pretty much what you do to blow through that $850, that $8 to $900,000 a year insurance plan type of a practice. Normally, if you do all those things in concert with each other simultaneously, that's why it doesn't get done, because it's a lot. It's not one thing. It's never one thing. The only one thing that is true is that it's never one thing. There's always multiple tweaks that you have to make to blow through these transitions. And once you go through these, you can get a single doctor practice. And I have single doctor practices that do, we know them, that do $2 million a year.
Yeah.
But they're rare. They're very rare. I'm going to say you're somewhere in the 1.4, 1.5 range, right? With two dentists, maybe not necessarily full time. And once again, you'll reach another plateau, and it will be almost for the same reason with the staff, but you've already gone through that, so you'll recognize it and be able to adjust for it. But the next one will be, Mark's version of the devil, which is pre-appointment. Pre-appointment will stagnate your practice at some point in your career. Just went through another one today. Doctor calls and says, I'm not getting enough new patients. We look, booked out 3 weeks. Why? They pre-appoint everybody and go through the whole scenario. Stop doing that. Start blocking your schedule for new patients, the whole 9 yards. That is going to happen to all of you at some point in your careers. So whether you're at an inflection point or a plateau point now, or you see one coming, or what the heck, you just want to do things better, not pre-appointing everyone is your next move. Actually, that'll help you avoid even hitting the plateau if you do it ahead of time. But that's causing a lot of practices to plateau, especially now. Now that we're in a recovery, it's just like unclogging a sink. You got to get the 30-35% of the patients who are not compliant to your recare out of there to free up and allow more new patients to schedule through your marketing, through your referrals, through your website, through whatever marketing you're doing, whether you're doing it through us or you're doing it through somebody else. It just frees it up so that patients that do want to be new patients in your practice have an opportunity to get into your schedule in a reasonable amount of time.
Great. Well, that's a bunch of good advice, Mark. Thank you. And we're going to call it a day here, and we'll see everybody next week, okay? Thank you. Bye now. We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatientsinc.com.